depression is more than just feeling sad. It's a complex mental health condition that affects millions of people worldwide. In this video, we're diving into the various types of depression, how they differ, and what you can do if you or someone you know is struggling. Whether you're curious or looking for answers, this discussion is for you. Welcome to Medical Minute, where we talk about health, and I try to provide you an approach on how to lead a healthy lifestyle. If you are new to the channel, kindly consider liking and subscribing. So let's get on to it then. Before we delve into the specific types of depression, it's important to understand that depression can manifest in different ways. Each type has its own set of symptoms, triggers, and treatment options. Knowing the differences can help in recognizing and addressing the condition more effectively. 1. Major depressive disorder, MDD. MDD is often what people think of when they hear depression. It is characterized by persistent sadness, a lack of interest in activities, and physical symptoms like fatigue and changes in appetite. According to the National Institute of Mental Health, about 17.3 million adults in the U.S. experienced MDD in 2017. This form of depression can significantly impair one's ability to function in daily life, with studies showing that it can lead to an increased risk of other health conditions, such as cardiovascular disease and diabetes. It is important to note that in MDD, the darkness does not descend suddenly. It creeps over you until you're surrounded. Have you or someone you know experienced symptoms of MDD? How did it affect daily life? We can discuss it in the comment section. 2. Persistent depressive disorder, PDD. Also known as dysthymia, PDD is a chronic form of depression that lasts for years. It's less severe than MDD but can make life feel like a constant struggle. Research from the World Health Organization indicates that PDD affects around 1.5% of the global population, making it a significant but often overlooked mental health issue. The condition is associated with long-term impairment, affecting social relationships and productivity. How to best understand this type of depression is, it's not the intensity of the storm but its persistence that wears you down. We can also discuss this question in the comment section. Do you think it is harder to cope with a milder ongoing depression compared to a more intense short-term one? 3. Postpartum and perinatal depression. Postpartum depression occurs after childbirth, while perinatal depression can happen during pregnancy. Unlike the baby blues, these conditions are severe and require treatment. A 2013 study published in JAMA Psychiatry found that nearly 15% of mothers experience postpartum depression, highlighting the need for greater awareness and support. This study also emphasized the importance of early intervention, as untreated postpartum depression can have long-term effects on both the mother and child. For some parents, it's supposed to be the happiest time of your life, but for many, it's overshadowed by a cloud they can't shake. Why do you think postpartum depression is often misunderstood or overlooked? We can also discuss this in the comment section. 4. Major depressive disorder with psychotic features. This severe form of depression includes symptoms of psychosis, such as delusions or hallucinations. It's rare, affecting approximately 0.5% to 1% of the population, according to a study published in the Journal of Clinical Psychiatry. People with this condition often experience significant impairment in their daily functioning, and the combination of depression and psychosis makes it particularly challenging to treat. The study underscores the importance of early detection and specialized treatment to manage symptoms effectively. How I like to think about it is, when the mind becomes a prison, reality itself can become distorted. What are your thoughts on the intersection between depression and psychosis? 5. Seasonal affective disorder, SAD. SAD occurs during specific seasons, usually in the winter. It's linked to a lack of natural sunlight and can cause symptoms like anxiety, fatigue, and weight gain. Research published in the American Journal of Psychiatry suggests that approximately 5% of the U.S. population experiences SAD, with symptoms typically starting in late fall and continuing through the winter months. The study also found that SAD is more common in regions farther from the equator, where daylight hours are shorter during winter. How do you feel about the impact of seasons on mental health? 6. Situational depression, also known as adjustment disorder. This type occurs after a traumatic event. While it's usually temporary, it can become chronic if not addressed. A 2018 study in the Journal of Affective Disorders found that situational depression is particularly prevalent among adolescents, with life-altering events such as divorce or the death of a loved one being common triggers. The study highlighted the importance of early intervention to prevent the condition from progressing to a more severe, long-term depression. For this case, we can think of this type of depression through this quote: "Sometimes it's not the event itself, but the way we're forced to adjust to a new reality." Have you ever experienced a depressive episode after a significant life change? How did you cope? 7. Atypical depression. Atypical depression includes unique symptoms like mood reactivity, feeling better when something good happens. It's often misunderstood and underdiagnosed. A study published in the American Journal of Psychiatry found that individuals with atypical depression often have an earlier onset of symptoms and are more likely to suffer from co-occurring conditions such as anxiety. This type of depression responds differently to treatment, making accurate diagnosis crucial. Do you think atypical symptoms make depression harder to recognize and treat? Depression is a multifaceted condition with various forms, each requiring its own approach to treatment. Studies have shown that understanding these types can lead to better support and more effective treatment. Whether it's major depression, SAD, or postpartum depression, recognizing the signs is the first step to getting help. Thanks for watching. If you found this video helpful, give it a thumbs up and share it with someone who might need it. Don't forget to subscribe for more content on mental health and wellness. And as always, drop a comment below. We'd love to hear your thoughts on today's discussion.